The female reproductive system undergoes significant changes during puberty. Puberty is a period of transition of a child to adulthood. However, this video focuses on the female puberty. Puberty is a complex process triggered by hormonal changes, involving the endocrine system. Though the exact timing of puberty can vary from person to person, it usually begins between the ages of 8 and 13. At this stage, girls typically experience the development of secondary sexual characteristics, such as breast development, growth of pubic hair, underarm hair, and changes in body shape. These changes are primarily driven by increased estrogen production. One of the most significant milestones in female puberty is the onset of menstruation or menarche. The ovaries, which are already present from birth, become more active during puberty. They start producing mature eggs, ova, to begin menstruation. Menarche or menstruation signifies the ability to conceive or become pregnant. The uterus or the womb also undergoes changes during puberty in readiness for possible pregnancy. Menstruation usually occurs around age 12 or 13. It can happen earlier or later depending on every individual. The hypothalamus in the brain releases gonadotropin-releasing hormone, GnRH, which stimulates the pituitary gland to release follicle-stimulating hormone, FSH, and luteinizing hormone, LH, to regulate the menstrual cycle and the development of secondary sexual characteristics. The menstrual cycle is a recurring process that starts on the first day of menstruation and ends with the start of the next period. The first phase of the menstrual cycle is the follicular phase, which is day 1 to 13. Ovaries produce and release sex hormones, like estrogen, progesterone, and small amounts of androgens, male hormones like testosterone, to regulate the menstrual cycle and maintain the uterine lining. The lining of the uterus, also known as the endometrium, thickens in preparation for the possibility of pregnancy each month of the menstrual cycle. Each ovary contains about 300 to 400,000 follicles in tiny sacs, and within each follicle is an immature egg, oocyte. Only one of these follicles will eventually become the dominant follicle every month. Follicle-stimulating hormone, FSH, and luteinizing hormones control the development of ovarian follicles and the release of eggs during ovulation. These follicles produce estrogen, which signals the uterine lining to start thickening. The corpus luteum releases progesterone, which helps maintain the uterine lining in case of pregnancy. A mature follicle ruptures, releasing a mature egg into the fallopian tube. This is the process called ovulation in the menstrual cycle. This is the most fertile period for conception. The menstrual cycle varies from person to person. Ovulation may occur on day 14, 15, or 16 depending on the duration of each individual's menstrual cycle. The menstrual cycle can vary in length from person to person, with cycles lasting anywhere between 21 to 35 days, averaging 28 days. When there is a sexual encounter during the ovulation period, the possibility of fertilization or becoming pregnant is very high. The third phase is the luteal phase, starting between days 14 to 28 or more after ovulation, depending on the length of each individual's menstrual cycle. If fertilization and implantation do not occur, the corpus luteum breaks down, progesterone levels drop, and this drop in hormones triggers the onset of menstruation. The thickened endometrial lining sheds, resulting in bleeding from the uterus. This is called menstruation. The blood flow can last for about 3 to 7 days. Some people may have light bleeding while some may have heavy bleeding. Cramps or pain in the lower abdomen or back, bloating, tiredness, pimples, sore breast, and mood swings are common symptoms of menstruation. These symptoms may improve with the start of the period and disappear after a few days or when the menstruation stops. The menstruation marks the start of the cycle again. It is important to note that, initially, the menstrual cycles for young adults or beginners may be irregular. Although menstruation starts during puberty, it may take some time for ovulation to become regular. This is normal and usually stabilizes over time. It's crucial to support girls going through puberty by providing them with education, a safe environment, and open communication about the changes they are experiencing. Empowering them to view menstruation as a natural and healthy part of their lives is necessary. This will help them navigate this significant phase of their lives with confidence and a better understanding of their bodies, to embrace their bodies without being ashamed or embarrassed about their periods. It is advisable to consult your pediatrician for evaluation and possible referral to see a gynecologist if necessary, in case of extreme abnormalities with menstruation or reproductive health. Thanks for watching.